Well, thank you and good morning. I'm very pleased to be here with my colleagues Mark Warawa, Gérard Deltell, and Harold Albrecht. Let me say at the outset that the issues that arise from the Carter decision raise many difficult legal, moral, and ethical questions. And having regard for the complexity of the matter, having regard for the sensitivity of the matter, I believe that all members of the committee worked in good faith as parliamentarians and as Canadians to deal with a very difficult issue. The committee's main report has some good recommendations, including in the area of palliative care. Unfortunately, in other areas, the committee's report falls short, and it is on that basis that the four of us, as members of Parliament, felt the need, on behalf of our constituents, and indeed on behalf of all Canadians, to identify areas where the main report simply does not deal with some key issues. So let me say that the Supreme Court gave Parliament a very clear roadmap on how to respond to its determination that the Criminal Code prohibition against physician-assisted dying contravened Section 7 of the Charter of Rights and Freedoms. Regretfully, the committee, in its main report, failed to follow the roadmap set by the Supreme Court. The Supreme Court determined that physician-assisted dying is a right for people who are competent adult persons. And yet, this committee, in its main report, opens the door to physician-assisted dying being available to minors. We find it very troubling that the committee would disregard the clear pronouncement of the Supreme Court by opening the door to minors. The Supreme Court also said that it was important to, on the one hand, balance individual autonomy with the need to protect vulnerable persons. It is therefore disappointing to see that the committee, in its main report, fails to recommend safeguards for vulnerable persons. The most glaring example of this is that there are virtually no safeguards in place for persons with underlying mental health challenges. Now, there is no group that is more vulnerable than people with underlying mental health challenges on the question of capacity and on the question of consent, both of which constitute prerequisites to access to a physician-assisted dying as determined by the parameters set out by the Supreme Court in Carter. And clearly having no safeguards for people that are mentally ill could not have been what the Supreme Court contemplated when they called upon Parliament to impose stringent safeguards. And I must say that it was disappointing that the committee did not strike the right balance in respecting the charter rights of medical health professionals with the need to ensure that those who fit the criterion of Carter have access to physician-assisted dying. Quebec managed to strike that right balance, but yet, for whatever reason, the committee completely ignored the model set forth in the province of Quebec. And with respect to Quebec, let me say that it is imperfect, and I'm not here to endorse the Quebec model. But the one thing is clear, and that is that the Quebec model is a far superior model to the model proposed by the committee in its report. So, in closing, let me say that a report that does not respect the parameters of Carter puts vulnerable persons at risk and does not respect the charter rights of vulnerable persons and medical health professionals is a report that is not supportable.
Merci, M. Cooper. Chers amis, alors comme vous le savez, j'ai été député à l'Assemblée nationale pendant 6 ans, pendant toutes les années où a lieu le travail concernant la loi sur les soins de fin de vie. J'ai d'ailleurs voté en faveur de la loi des soins de vie à l'Assemblée nationale. Je suis très à l'aise et très fier de ma décision. Et ce que je constate aujourd'hui, c'est que le rapport du comité parlementaire s'éloigne beaucoup trop de la loi québécoise, particulièrement sur les enjeux que je trouve majeurs. Tout d'abord, la question de l'âge de consentement. La loi québécoise est claire. Elle ne s'adresse qu'à des adultes consentants. Or, dans sa recommandation 6B, le comité ouvre la porte aux mineurs. Pourtant, dans sa sagesse, la loi québécoise a exclu les mineurs. Deuxième point, les maladies psychiatriques. Dans sa recommandation 3, le comité affirme que les soins de vie peuvent s'appliquer pour les gens souffrant d'une maladie psychiatrique. Encore une fois, dans sa sagesse, la loi québécoise n'inclut pas les soins pour les gens qui souffrent de maladies psychiatriques. Le consentement préalable. La loi québécoise stipule que le consentement du patient ne peut être donné qu'à la fin de vie. Le rapport, lui, va plus loin et ouvre la porte au consentement préalable. Donc, je vous rappelle que ces 3 éléments majeurs, à mon point de vue, et qui sont loin du consensus québécois et de la loi québécoise. Nous aurions également souhaité que le comité accorde une plus grande importance aux soins palliatifs, comme ça se fait au Québec, et une meilleure protection pour les cas de conscience. Je vous rappelle qu'au Québec, un médecin qui ne veut pas traiter doit expliquer à son patient toutes les avenues possibles et le référer à un corps indépendant, ce qui n'est pas le cas dans le rapport du comité. Donc, à mon point de vue, le rapport du comité s'éloigne beaucoup trop de l'expérience québécoise, de la loi québécoise qui ne s'adresse qu'à des adultes consentants, qui ne parlent pas des gens qui souffrent de problèmes psychiatriques et qui également offre de meilleures protections concernant le consentement préalable.
Mesdames, Messieurs, good morning, ladies and gentlemen. My name is Mark Warawa. I'm the official opposition critic for seniors, and it was an honor to work on the committee. We heard diverse opinions on this from Canadians and also from the many witnesses that we heard. I was particularly concerned that the report had recommended that seniors, particularly those with dementia, mental illness, that they would not be required to be assessed to make sure that they have capacity, the ability to give consent. And the Supreme Court decision in Carter clearly said that it had to be a consenting adult, a competent adult. And without consent, then what I believe is the Supreme Court was clear that without the ability to give consent, then that individual would not qualify to be considered for assisted suicide or euthanasia. The report does not require that. It's recommended that an assessment is not required with somebody with an underlying mental illness. The other major issue for myself is, and I've heard from a number of physicians that are seniors themselves, still practicing medicine because they love to help people. And they've expressed a concern that they do not want to participate in providing assistance in hastening the death of an individual, one of their patients. And so the Quebec model does not require that. Fact is, there is no other model that requires that, but the report is recommending that a physician be required to provide an effective referral. And the effective referral meaning that the physician has to follow and make sure that that person receives the assistance in committing suicide or euthanasia. And that, what does that do regarding protecting the conscience rights of physicians? Many physicians have indicated that they may end practicing medicine if they're forced to be involved with this against their conscience. And we already do not have adequate number of physicians in Canada. So there are some very serious unintended consequences if the government creates legislation based on that. So as has been said, the report was not all bad, but it deviated, I think, extremely in some cases from what the instructions were from the Supreme Court in the Carter decision. And my hope is that the government will consider what we heard from a full range of witnesses, and making sure that it's in line with Carter decision. Thank you.
Thank you. I want to thank my colleagues for their remarks. My name is Harold Albrecht, a member of Parliament for excuse me, for Kitchener-Conestoga. Many of you will know that through the majority of my parliamentary career, I have spent a lot of time and invested a lot of energy in initiatives that are trying to prevent suicide and to work with those who are facing mental health challenges. And my concern is that in the report, there are not adequate safeguards to protect those who may be going through a temporary time of depression, mental health challenges, and while they may not be remediable in the sense of a total cure, there are many people living today who have gone through severe depression who, if this model is adopted, could in fact find themselves in a situation where they've taken a permanent solution, unfortunately a tragic permanent solution, to what was in fact a temporary problem. So those are my concerns. Thank you.
Can you maybe clarify the safeguards for the mentally ill? Does this report not talk about two doctors independent of each other? I don't know who wants to answer it. Two doctors independent of each other and witnesses and a waiting period. Is that not in there for the mentally ill?
Well, the issue comes down to the fact that if, for example, one of the two physicians identified a psychiatric illness or condition, there's no reference in the report and no recommendation that an individual in that case should be referred to a psychiatrist for a psychiatric assessment. And that really is a problem.
Because a foot doctor's not going to do it. Don't you think you'd need someone capable to assess how bad your psychiatric condition is?
I agree, but unfortunately the committee doesn't recommend that in its main report.
Amendment, isn't it? It's not just an amendment, make sure it's a foot doctor?
Well, the fact is the committee is very clear in its report, and that is there is no recommendation that an individual should be referred to a psychiatrist, and we think that that's very important.
The whole question of an adult, the Carter decision uses the word adult but doesn't define what that is. So what exactly is the problem with taking a look at the issue of a mature minor to take a couple of years to explore that and see if the legislation should address the possibility of opening up the age group?
Well, the Supreme Court was very, very clear. They said a competent adult person. If the Supreme Court contemplated minors, they would have said so. They would have simply said competent person. They didn't say that. They said competent adult person. So the parameters were very clearly set by the Supreme Court, and what we have to do in the way of a legislative response is ensure that that legislation satisfies the parameters of the court.
Is there any way that any of you four could have supported this report? Are there any, a set of circumstances under which you would have, or are you opposed to the practice, for whatever reason, and in essence that prohibited you from supporting the idea of a legislative framework in the first place?
Well, first of all, the issue of should we or shouldn't we have physician-assisted dying, the train has left the station. The Supreme Court is very clear that this is a constitutional right under Section 7 of the Charter. No one disputes that. That wasn't the mandate of this committee. The mandate of this committee was to look at the decision and recommend a response. Unfortunately, what we have is a report that doesn't follow the evidence with the need to protect vulnerable persons and does not follow the law by respecting the parameters of Carter.
It's a good question, though. Are you actually against physician-assisted suicide no matter what?
It's an irrelevant question.
Irrelevant.
It's not
Why is it irrelevant?
Because three of you up there are identified by certain pro-life campaigns as being pro-life. So is it even a possibility that you would support a report on assisted dying? Or were you against it from the get-go?
Well, let me just make it clear, because you're talking about three persons, but there is a fourth, and it's me. And I was member, and thank you so much, but it's quite important what you raise as question. I was member of the National Assembly, and I was witness of all the work that have been done in Quebec to achieve la loi sur les soins de fin de vie. And I voted for. Yes, I voted for this law after 6 full years of hard work. And so this is why we had to deal with that. The question is not, are we agree or not with that situation, is how? Because the Supreme Court was quite clear. You shall adopt a law until at the end of June or the beginning of June. So the question is not, are we agree or not on that issue? The question is how. And my experience, Yes, but it's the same situation for everybody. Because the question is not if we are agree or not on that issue. The question is how to deal with that. In my experience as a National Assembly member in Quebec, I voted for the law because, as far as I'm concerned, it was very respectful and we have good safeguard to the most vulnerable. And on some issue, unfortunately, the committee do not respect that, especially on the age, because they open the door to minor, which is not the case in Quebec, and also about psychiatric illness. Unfortunately, they open the door to that, which is not the case in Quebec.
But this is an issue of conscience, and in Quebec there was a free vote because it's an issue of conscience. So is it fathomable for one of the three of you, not Monsieur Deltell, to vote to allow physician-assisted dying, or is it unfathomable because it goes against what you believe?
No, I think there were diverse opinions. Nobody that came to that committee started with a blank slate. Everybody started off with a position of whether or not they supported assisted suicide. But as has been expressed, it's not relevant in that the Supreme Court made that decision. The Supreme Court said that this has to be permitted. It's a charter right of Canadians to have access to that. Our job was to make sure that there were proper safeguards. And I wished, and I worked constructively. I'm sure my colleagues, I know they did try to work constructively. And if we would have provided, adequate safeguards for those that have a mental illness, if an individual with a mental illness does not have capacity to buy a cell phone contract, how could they be deemed to have capacity to commit to give permission to end their life prematurely? And so if there would have, in that, that's one example. Another one, I agree with Michael Cooper that the court clearly said it was an adult, a competent adult giving consent. And if that's just two examples, and if we heard time and time again from witnesses that there is no other regime where physicians or institutions are required to be involved with if it's against their conscience. And so if conscience rights would have been protected, there would not have been a dissenting report. I would have supported that.
Circumstances under which you could have supported this.
Absolutely, yes. And I wish that there would have been not necessary to have a dissenting report, that we would have truly written a report that was representative of what we heard from the witnesses. And I don't believe, I think and again, you have different perspectives on this, and I think, I don't know why, but for some reason, the report goes far beyond what our mandate was. It goes far beyond the Carter decision, and I think that's the root of the problem.
Do you actually believe it's a charter right?
Well, the Supreme Court said it was.
But do you believe it?
To the microphone, please.
Yeah, the Supreme Court said it's a charter right, and so in Canada, it's a charter right. It is a charter right. I believe that's the Supreme Court decision, yes. And I think we're living in a democracy. We need to respect the laws, yes.
Oui. Vous avez déploré que la porte soit ouverte à permettre l'aide à mourir aux mineurs d'ici 3 ans, mais le fait est que le jugement ne définit pas ce qu'est un adulte. Le jugement ne parle pas de soins en fin de vie comme la loi québécoise. Donc, est-ce que c'était pas un peu doomed, pour prendre une expression?
Excusez-moi, je suis bilingue.
Décidé d'avance que la loi canadienne irait plus loin que la loi québécoise.
Bien, attention, parce que quand même, quand on parle d'adultes consentants, c'est peut-être pas spécifié 18 ans et plus, mais dans ma compréhension à moi, quand je lis un texte de la Cour suprême qui parle d'adultes consentants, c'est 18 ans et plus. Et c'est exactement là où la loi québécoise est. La loi québécoise parle de 18 ans et plus, point. Et c'est pour ça que j'ai voté en faveur de cette loi-là, moi, comme député provincial. Mais ce que je n'aime pas dans ce rapport-là, c'est qu'on ouvre la porte aux mineurs. Et pour moi, ce n'est pas une question qui devrait être abordée.
Pour les médecins objecteurs de conscience, là, vous en parlez au Québec, ils ont l'obligation de référer. Oui. Là, vous dites le contraire dans votre rapport, vous n'êtes pas d'accord. Donc, vous croyez qu'un médecin qui n'est pas à l'aise avec l'aide médicale à mourir ne devrait pas avoir le devoir de référer?
Attention.
Vous avez cheminé, quoi?
Non, ce n'est pas une question de cheminer, c'est une question de fait précis. Puis il y a une nuance qui est très importante. Je vous remercie de poser la question. Au Québec, ce qui se passe, quand un médecin a une difficulté morale avec la situation, ce qu'il fait, c'est qu'il doit d'abord expliquer aux patients toutes les avenues qui sont là. D'ailleurs, dans notre rapport, on définit très bien dans le chapitre concernant l'expérience québécoise quelles sont les démarches que le médecin doit faire. Donc, quand un médecin ne veut pas procéder, il doit référer le patient à un corps indépendant, soit la direction de l'institution, et la direction de l'institution, après ça, réfère le patient à un médecin. Et c'est là la nuance. C'est que dans le rapport du comité, le médecin doit parler à un autre médecin. C'est de la dentelle, je le reconnais. Mais j'ai parlé à des médecins québécois. Pour eux, qui ne sont pas d'accord avec cette approche-là, qui ne veulent pas traiter des cas de soins de fin de vie, pour eux, de parler directement à un autre médecin, c'est un gros cas de conscience pour eux. Et c'est pour ça qu'au Québec,
à mourir s'attend à ce que le professionnel de la santé fasse une référence, non?
Oui,
à la base,
voilà. OK, juste laissez-moi finir la nuance parce qu'elle est importante, puis je vous remercie de poser la question. C'est de la fine dentelle psychologique, mais extrêmement importante dans des cas semblables. Oui, c'est un principe, et le principe est respecté au Québec. Parce que le docteur qui ne veut pas procéder doit référer le patient à un corps indépendant qui, lui, réfère un autre médecin. Il y a des médecins qui ne sont pas à l'aise de référer un patient à un autre médecin dans ces cas-là. J'ai parlé à des médecins qui m'ont dit ça. Et c'est pour ça que la loi québécoise est bien faite. Parce qu'elle crée une espèce de corps indépendant qui fait en sorte que le médecin qui ne veut pas n'a pas à donner directement les directives à l'autre médecin qui, lui, va traiter. Ce que recommande le comité.
Il n'aura pas ce qu'il veut.
C'est quand on respecte, ça concerne davantage le respect du médecin. Parce que le patient, en bout de ligne, va avoir les soins. Ça, on le respecte là-dessus. La loi québécoise le respecte, puis on n'a aucun problème avec ça. J'ai voté en faveur de ça. Mais la grande nuance est la suivante. C'est qu'au Québec, le médecin qui ne veut pas traiter réfère le cas à un corps indépendant, soit la direction de l'hôpital, qui, lui, réfère à un autre médecin. Alors que là, actuellement, selon le comité, c'est de médecin à médecin. Et moi, pour avoir parlé à des médecins qui pratiquent ça, ils sont très mal à l'aise avec cette situation-là. Et le Code du Québec, la loi du Québec, protège de belle façon les cas de conscience des médecins, ce que ne suit pas le comité.
How would you have preferred the mental illness element to be handled? Would you have wanted the committee to say it had to be a terminal illness and not open the... So what's the solution there for the mental suffering element of assisted dying?
Well, let me talk about the Quebec experience. As I told you, in Quebec, we do not open the door to mental illness. And because it has been a long debate in Quebec, 6 full-year debate, 2 full years of consultation with more than 275 persons. They crossed the province everywhere. They met people in eight different cities. So it was a very serious exercise, and we took the time in Quebec. And at the end of the day, we conclude that it's not good to have soins de fin de vie to the psychiatric illness.